Thank you everyone for joining us. This is the third in our series of Clinical Innovation Award webinars, as all part of putting together support and content for anybody thinking of applying to the Clinical Innovation Award. I won't go through what the Clinical Innovation Award is again, because people are hopefully at this point they're aware of it. I'd like to introduce Fionnuala Brown today, and Fionnuala is a Commercialisation Executive with the Technology Transfer Office in NUI Galway. Fionnuala, thanks for joining us.
No problem at all. Delighted to be here. Yeah, I suppose I should just clarify. Yeah, so I work in the Technology Transfer Office, but we are also called the Innovation Office. So if you hear both terms bandied around, they mean the same thing, and they all relate back to me and my colleagues.
Super. Yeah, thanks for clarifying that. I suppose I guess I might ask you to introduce yourself first, Fionnuala, to just a little bit about your professional background.
Yeah, of course. Yeah. So as Steve said, I work in the TTO in NUI Galway as Commercialisation Executive. And what I mainly do is I work with in the medical technology space. I do a lot of work with CURM, the SFI Centre for Research Medical Devices. And I also work with the School of Medicine and the School of Engineering. And really what I do is I suppose I support them through their research and development life cycle with any sort of queries they have about kind of bringing that research out into the real world and interacting with whether it's industry, other institutions, or other just individuals in the outside world, outside of the university. I help them with whatever sort of support they might need.
And I can verify that that is exactly what you do, because you've been a huge help to us with the number of projects to date anyway. Thanks, Fionnuala. So I suppose technology transfer offices are important, in their own right, in terms of bringing technologies forward and, towards kind of commercialization or towards the real world. They're important in the Clinical Innovation Award as well, because it requires somebody from a tech transfer office to kind of sign off on these applications. So I suppose in the first instance, would you mind just telling us what is a tech transfer office and what its function is, kind of in the broad sense, bearing in mind that the people here mightn't.
I think it's always a little bit mysterious what we do, but as I kind of said, we're really one of the support functions in the university, and we're really there to help individuals with their research and their development, at whatever stage it's at. So if you think about it, a lot of our work would involve, as I call it, the outside world, as I say, whether that's industry, whether that's funding bodies, whether that's hospitals, whether that's other institutions. And we really help, I suppose, a lot of with the contractual matters. So I suppose when you're doing work and doing exciting research, there is a lot of legal things going on in the background that to enable you to be able to do what you're doing. So we're really here to take that stress and that added burden away. We kind of look after all of that, whether it's confidentiality agreements, whether it's material transfer agreements, we have a lot of those with the hospital in particular, whether it's a research collaboration agreement, that'd be a big part of our work would be industry coming in to work with the university on specific research problems and really trying to bring those forward to industry. So, to commercialization. So that's really what we do. And then at the other end, when research and development is kind of coming to a conclusion, that's really where we step in and help individuals, because a lot of times if you're working on research, you might not be exposed to what the opportunities are beyond research, what you can do with the outcomes. And sometimes those are predetermined. Sometimes it's already agreed what's going to happen at the end of a project or at the end of something you're working on. But other times there really is kind of, the world is your oyster in terms of what you can do. Some people want to go on and start companies with their research and really validate it through and bring it on. Other people want to see it go into the real world and want to see it have impact, but really don't want to be part of that journey. And, that's when we kind of help them look at maybe licensing, or maybe even they just want to communicate it to other people within the research space, and kind of get it out to their peers just to kind of build on foundational knowledge. So there really is a lot of options for people. I suppose today I think we're going to focus mainly on kind of the commercialization and bringing it forward through that kind of self-motivated, self-driven journey of an entrepreneur.
Yeah, that's exactly it. There's two things there that I just want to kind of reiterate, I suppose, Fionnuala. The the opportunities beyond the research, and just to frame that a little bit for the people for the clinical innovation award, or for those who are applying for it, this is the first step on that kind of journey. Like there has to be an end goal. It isn't winning this prize fund to do the market report and down tools. If that market report is if it comes back positive, it's showing that there's a large market or an appetite there to develop your solution, and for people will pay for it or use it, then you really have to be thinking the long game, and that is setting up your company or getting it to a point where it's a licensable technology, and that's you guys are there to help in that sense as well.
Yeah,
And don't
absolutely.
be afraid to tell me to stop me if I'm butchering any of this. And the other thing too is the supports that you provide in terms of the agreements, the not confidentiality agreements, collaboration agreements, and all that sort of stuff. It's expertise that people normally won't have. But in this context, you don't necessarily need to have that expertise, because you're there for that. You're there to support.
Absolutely. What's key to us is really the ideas. That's what we can't come up with. That's the part that we ourselves can't do. So that's where we're relying on the likes of people on this webinar today, and others within the university. Because we really can do a lot. Once you kind of have an idea and you have kind of, I suppose, an inclination that there's a real need for it, we can really help you. There's a lot to do in terms of maybe just skills you wouldn't have encountered before, in terms of looking at market reports to try and ascertain the market size and really validate that, looking at regulatory pathways. There's all these things that I suppose the minute you see them, you feel a little bit daunted and you feel a little bit scared. But in terms of engaging with us, that's what we do day in, day out. So we're more than happy to help. We're more than happy to kind of guide you along, and we understand that this isn't something that you've encountered readily before, and that I suppose kind of walk you through it. So it's absolutely, for us, we're more than happy to engage, as I say, whether it's contractual matters, whether it's helping even just to structure maybe even a commercialization fund application may look like after a feasibility study, or whatever it may be. We will have some experience in it. As I say, it's really just getting those ideas to our door to kind of see what they are, and guide you in the right direction.
And we have other content on our YouTube channel from to your colleagues in NUI Galway, Professor Gary Duffy and Professor Alicia McNamara. They're both the Vice Dean for Research and Innovation, respectively, for the College of Medicine, Nursing and Health Sciences, and for Science and Engineering. And this is one of the points that they hammer home too, is they need to meet with the clinical people to get the ideas, and then they can work on the solutions. So it's it seems to be a common thread going through the series. So we might move on a bit to intellectual property, which is something that is hugely important for a lot of respects. But how does a tech transfer office or a university work with a person to develop their intellectual property? What's kind of the process when they come in with an idea?
Yeah, exactly. So generally people do come in with an idea. So whether or not there's intellectual property there at that point is kind of hard to really ascertain. Intellectual property is a catch-all term. And I think when we're particularly working in the kind of the clinical, the medical space, we tend to lean towards patents as the form of intellectual property we're talking about. And certainly, if you're embarking on a journey where you do have aspirations to go forward and maybe form a company, certainly looking to try and protect yourself and fence off your idea is a really good move early on. But what I would always say is the earlier the better. So as I say, I'm going to talk about intellectual property in the context of patenting mainly, just because I think that was what would be what's most relevant here. And we don't need to know all the details about what the exact process is, but the patent process is a very unforgiving one in terms of it's a very specific timeline. So and there are a lot of rules and requirements. And again, that can sound daunting, but it's again what we do day in, day out. So early engagement for us is always best, to hear about that idea early on, where we can kind of speak to whoever it is and really tell them, well, these types of aspects of your idea would be patentable. So you should really hone in and focus on those and really refine those, because once you can ascertain, what might be patentable in your idea, if that's the route you're going, to really strengthen those out will give you, I suppose, a lot of value in your idea early on. And, for the likes of applying for funding and to get that, that research and development going, it's a really kind of strong thing to have early on. So certainly what we would do is, look at the idea, would get you to describe it, in a kind of 1 or 2 pager. And then we talk about the plan, right, well, whether is this ready for patenting or not? Is it even patentable? And if it's not, there are loads of options that we can make use of. It's not the be all and end all to patent something. And sometimes it may be that you might need an animal study to do some validation work. Other times it might be that you just need to kind of really refine out whether it's an actual what actual problem it's solving, because that is important. So sometimes people come back to us in 3 months, sometimes it's 6 months, sometimes it's even longer, and kind of come back then with a more robust description of it. And then from there we look at what would be the best time to patent, because we also want to look at, well, where are we going to go with this? How are we going to bring this forward and get it into the market, and how long is that going to take? So there's a little bit of strategy and aligning of timelines. But certainly for me and for my colleagues, we definitely like to see the earlier the better, as I say, because there's just a lot of rules and requirements around patenting. And sometimes if people are coming a little bit too late, which they tend to, because people like to think, they think that we want to see something fully formed, almost like a prototype ready to go. And that's absolutely not the case. Quite often we want to hear about it, even when it's just still all up in your head, and you're just really figuring it out. We'll support you on that journey.
I will say there are people who do want to see that prototype, but they are after they've met with the TTO and gone through this process.
Absolutely.
So like, again, you're there to help, and I think it's a really good point, Fionnuala, you made about aspects of an idea that are patentable, or where there's freedom to operate or dive in further, because when you're reinventing, you may be iterating or improving on something that's out there, and your improvement might be what's patentable as opposed to the whole thing. Just for people.
That's a really important point as well. I should have mentioned, Steve, is that our best innovations and the biggest success stories we've had in the university are always improvements on existing technologies out there. Very rarely does something reinvent the wheel, where it goes from kind of the full life cycle and into a huge success story. Small incremental changes are really what is out there that is making a difference. Just small improvements on existing technologies, because they're all trying to solve a problem. Whereas I suppose the burden to actually de-risk something that is completely disruptive is huge. And while it is certainly possible, it's not a requirement. And I sometimes think as well, people, when they're innovating and coming up with ideas, think this isn't new enough, this is well known. But actually that's not the case. They're just a huge expert in their field and they think it's really obvious, but to a lot of people it's not. So sometimes I advise people not to overlook what they think is just kind of the norm.
Yeah, it's funny, because people who are experts in an area, and whether it's clinical or if it's a technical space, you don't realize that other people, most of us, have no idea.
Yeah, exactly.
What you're processing. I want to talk a little bit about the do's and don'ts of IP or trying to file a patent or go down protection. And we kind of spoke about this, but just before. One of the things and you mentioned it there earlier, was around the timelines. I suppose I'll just let you free talk there, Fionnuala, around the do's and don'ts possibly is probably more important.
Yeah, so a huge aspect for patenting, and just for any form of intellectual property in general, is confidentiality. So one of the main things I would advise always is to keep things confidential. And that can be quite tricky. And I spoke about this recently within the university. Sometimes I think we assume who is it within our confidential circle, whether they're work colleagues, whether they're people working in the same space as you. Sometimes I think we presume automatically that people are within our confidential circle. It's fine to tell them things, but it's not to be cynical, it's just to be very careful when you have something that could be valuable and is very important to you, to not give away too many details about it. You're absolutely able to tell someone what you're working on, but maybe you don't need to distill down exactly what you're doing and the sort of results you're getting, and whether there's an improved efficacy or whatever that may look like for you and your work. It's really important to maintain confidentiality, at least until you've spoken to someone like ourselves at the TTO to see whether or not you are going to go forward with, for instance, patenting, or even to get funding from a some body to bring the innovation forward, because a lot of times the value at the beginning is in it being confidential. So that's my main point. If you take anything away, it's to keep things confidential at the outset. And there's loads of ways to engage with people while keeping things confidential, as I mentioned, confidentiality agreements and things like that. And as I say, another thing for patenting is, and for intellectual property in general, is when you're embarking on this journey is you need to be a little bit dynamic and a little bit flexible, because from my experience and looking at people who have gone through this journey, very rarely is what you originally come up with going to be what you finish with at the end. And it can be quite difficult at the outset when you have come up with something, and it's great because people are really passionate about their ideas and about bringing them forward and the way you'd like to see them go. But with intellectual property, as I say, there are a lot of rules and requirements, and you will be told you can do this and you can't do that, and you're able to have protection on certain aspects, and you may need to tweak things as you go to strengthen your intellectual property protection. And that's absolutely fine. But as I say, it's just something to be aware of from the outset, because as I say, some people are very tied to the original way of doing things. And I think for even just putting the intellectual property aside, for embarking on this journey, you do need to be dynamic, and you do need to be, I suppose, able to change when required, and make those amendments, whatever they may be. As I say, I don't know any one who's embarked on this journey under NUI Galway who's started out with something and ended up with the exact same, after a few years. So
I absolutely 100%, and it's not just, as you said, it's not just around the patenting process, it's everything. It's the market signals, it's the clinical need. We'll have Emily Naylor and the rest of the guys on her team speaking to us in as part of the series, and they came in with one need and it dramatically changed for multiple factors. And even when we got to speaking to the TTO in their institution, it changed again. So it's still attacking a need, and it's getting there, but it's unrecognizable from where they were 6 months ago, even 3 months ago. And I think Professor Gary Duffy in his one as well, he speaks about that being pivoting.
Pivoting is a great word. Pivoting is a key word. Absolutely, it's something that's really important. And as I say, it's just being willing to adapt and being willing to kind of look at the bigger picture. And that's just the last thing I wanted to say about advice kind of for intellectual property and do's and don'ts. One of the things I would say that you need to do is think really big at the outset as well. So you may have your kind of core idea, but think big, and it doesn't have to be validated, but just for the purposes of patent protection, it's great to kind of speculate about what you might be able to do with it as well. If you're using something in one specific area of the body, could it be used elsewhere? What else could it do? Are there any other aspects of this that you could develop out? Because when you get further down the line, again, not only to do with patenting, but people are always interested, well, it can do that and that's great, but what else could it do? Or what else could you bring this into? So it's really good to kind of have your core idea, but it's also a great thing to be able to think big at the outset, as I say, just for the purposes of patenting and seeing where you might go.
Absolutely, that kind of being able to scale into other areas or conditions, it's massive. Okay, I'm just keeping an eye on the clock here. I don't want to go on too long. I suppose you've kind of given a lot there now in terms of, you know, engaging with the tech transfer office and the supports that you provide, and you know, the do's and don'ts on, you know, even patenting and that, and don't go too early and in terms of filing a patent, but definitely come in early with your idea
Yeah.
and you know, help use the supports there to help develop it. I suppose and this is kind of back to the feasibility applications. And you may not have one, but can you give an example of the successful components for a feasibility application that you've seen? And just for context, the Clinical Innovation Award is very similar to a feasibility application. That it is basically, you know, you want to see what the feasibility is, yeah.
Yeah, I understand the structure to be largely the same. So yeah, I think for the feasibility, it's a great question, because this is a lot, as I you know say, the first step for a lot of people, so it can be really daunting to know what to put into it. I would say for me, one of the things I would say not to do that I've seen people do is to put a lot of information in about the technical aspect of your idea. And as I say, you know, a brief description is fine. That the technical detail will come maybe in sequential funding applications and in that further research and development. What you really want to do is kind of outline the story of where this idea came from, as in, you know, where did you kind of pick up that there's a need for this, and you know, how have you validated that this is a real need and that people will, you know, want to actually pay money for this, and that this will actually have impact in society. So it's really about just outlining what your idea is, and then, as I say, backing that up with that there is an actual need for it, and that people, this would benefit people, you know, if it were to make it to market. I think what can really strengthen an application is being able to display that you've spoken to experts in the field, and a diverse range of experts. You know, a lot of times, in particular, what I see is a lot of people focus on Ireland, so we'll get a lot of expert opinion from clinicians in Ireland, which is great. But particularly when you're looking to commercialize, you need to think big, you need to think global. So, you know, trying to get those clinicians, whether they're in the US, whether they're in Japan, wherever they be elsewhere in Europe, it doesn't really matter, but trying to get a diverse range of, you know, kind of opinion or feedback at the early stage, even if it's just one or two lines, is a great strength to the application. And also being able to convey in a feasibility type application that you have a plan. That's probably one of the most important things. You kind of highlighted earlier, people don't want to, you know, just see that you're going to get a report and then just leave it sitting on a shelf. They want to be able to kind of read off the paper that, you know, you want to bring this forward, you want to commercialize it, you have a plan, you've kind of got a vision as to how things might pan out over the next few years, and really, you know, how you're going to get there. And again, that can sound a little bit, you know, like a lot to put in an application, but it's really just a general sense of what you want to do and how realistic that is. And that would probably be the main one, as I say. But for me, definitely, you know, that's kind of a core aspect of it, but definitely the global aspect, I think, is one that really strengthens an application, to kind of think about the markets from a really global context, think about your experts from a global context, and really broaden everything out.
And I say this quite a bit, particularly working with people, for those working in the healthcare context. They know who the experts are. Exactly. They know who are publishing in the space. They may even work with them. So you can reach out to them, you know, or email them or whatever. You probably even know somebody who knows them.
Exactly.
Which I think is it's an irony, because so many companies trying to develop products are always looking to speak to clinical people everywhere and anywhere, and they have such, you know, it's such a challenge for them to get that access. I suppose I should mention as well, we have on the website for the Clinical Innovation Award, we have a kind of how-to guide which covers some of that, you know, how you go about engaging with people to verify the need or validate the need and that sort of stuff. So that's on our website, www.hih.ie. And the last question, I suppose this one, you've covered it already, but it's probably just to hammer it home. What advice would you give to anybody who's looking to apply to the Clinical Innovation Award?
Well, first of all, I'd say go for it. If you're thinking about it, absolutely go for it. Don't hesitate. But as I say, we've kind of talked about it a lot, but really thinking about the need, like, as I say, what people want to see when they're reviewing these is that there's, that your solution, that there's a need for your solution essentially, and also that there's commercial opportunity with that. That there is scope for this, that this will be viable, because obviously something needs to be commercially viable in order to kind of invest in it and put money into it for the research and development. So I think it's really important to kind of get that bit of background early on. And as I say, a good way to do that is really to just get to talk to some people, as I say, under confidential terms, to just kind of ascertain what they think. And you don't need to actually tell them what you're doing by any means. You can just ask them, do you think this is a problem? And what would you say are the most frustrating aspects of this, and really kind of ask them those types of questions rather than saying, this is what I've developed. Do you think it's a good idea? Because by and large, people will say yes to you because they don't want to offend you. So it's really trying to drill down into whether there's a need or not. And then also about obviously knowing who else is out there and what they're doing. Sometimes we see people working in an area and, that they've got a great idea. But when we look at the big players, all of a sudden they've all pivoted away from it. And that can be a huge indicator for us that there's something out there that we haven't yet uncovered that is a huge barrier for us. So to look at the competition, look at what they're doing and the way they're operating. And that's not to say you're going to copy what they're doing or their path by any means. It's just to make sure that there is kind of clearance in that field to keep going with what you're doing. And obviously, as I say, the bigger the better in terms of thinking about your idea. If your idea has multiple applications, it's going to be much more attractive to somebody reviewing it, because if you had a barrier or a wall with the first application, if it can go into something else, then it's great. Whereas if your idea or your technology is only really focused on one area, and then we had a barrier with that, it's very tricky to kind of pivot there and then. Whereas I say, if you've kind of fleshed out those ideas at the early stage, even just a little bit, it can make things a lot easier, and it really strengthens an application.
Super, brilliant. Thank you so much, Fionnuala. You'll hang around for a few questions if we have any. And I should say, we're speaking to you. You're based in the Technology Transfer Office, the Innovation Office in NUI Galway. Every single academic institution in Ireland has a technology transfer office as well. So this isn't, the supports are there near wherever you are, applicant.
Yeah.